Hello everyone, today we will take MPC 001 Block 1 Unit 3. So it is about neuropsychological basis of learning and behavior. So till now we have learned what is learning, what is memory and all. Now we are going to understand what is the neuropsychological basis of learning. Neuropsychological basis means like neurological basis means what happens in your brain, like chemical changes or new connections and whatever it is. And then psychological, like how you perform those functionally. You do those things like you store and retrieve your memory, how you learn, all those things we will discuss in this unit. So in this unit it is like included just like any other unit, like introduction and objective, as well as the brain and the memory. So how memory is connected to brain, what role your brain plays, that is what we are going to discuss. And then how memory consolidate means like how it is like becoming strong and like stored. And then anterior lateral temporal lobes and memory, the role of anterior and lateral temporal lobes in the memory. And animal models of the memory, imaging the human brain and memory. Okay, like how you like image and everything is involved in human brain. And then cellular basis of learning and memory, and then we will summarize it. That's it, that we will discuss in this unit. So basically it is focuses on neuropsychological basis of the memory. So if we talk about memory, like so we have discussed about that in previous units. So learning is the process of acquiring new information, like that is what learning is. You are learning new things. And whereas memory refers to the persistence of the learning, meaning that whatever you have learned you have stored at like in your brain, and then whenever it is required you are using that information. That is like you can say memory. You can use after storing it, you can use whenever it is required. Suppose you have learned like alphabet and the grammatical rules. Now when we are discussing this topic, we are using that knowledge that is stored in our brain. Suppose something is not, suppose this is like we are speaking in English. Suppose the language is you can say Tamil or Telugu or some other language. So we don't know that language, so that is not stored in our memory, so we cannot use it. So that is what memory is. So if you have that information, you can use it. So learning and memory can be subdivided into major hypothetical stage: encoding, storage and retrieval. We already talked about it, if I say. And then like it was encoding. This is understand brain. What brain does, that is a different thing. This is what we have hypothetically created to understand the process of memory and the brain and how we use it. So encoding, storage and retrieval means how you store information. Number one, storage, like how means in which means, like I have already discussed, like in computer we use binary language. Similarly, how we use that information, how we encode that information that we are getting from our you can say environment through senses. And storage means how we store it. And then retrieval means whenever it is required, how we retrieve that information. That is what you can say three stages in learning and memory. The objective of this unit is describe the process of memory in the brain. Already I told you this, and define neurological issues related to memory, define neuropsychological basis of memory, and explain the neural process of learning and memory. So understand all these four things. Objectives is like how our brain process the information and store it in simple terms. and brain is a biological organ actually, है ना? So what happens in the brain and in which form the brain stores the information, and how we use that information whenever it is required, and how we function the like if suppose your memory is lost, so what will happen to you and how you will behave, that kind of thing. And the neural process of learning and memory. Neural means that we know that brain is made up of neurons. Neurons is the brain cells. So what process happens there, how they are connected to each other, how they process like all learning and memory. So that is what we are going to understand. So in layman terms, you can say how our brain process learning and memory and store it. That is what we are going to study. So memory and brain, first thing. So memory and brain is very important to understand, number one thing. And why it is important to understand because like we want to understand how our learning and memory changes our brain, or how they store it, right? And the importance of this is, if we will understand these things, we can improve memory, or we can work on our brain, or we can work on our behavior so that we can increase our memory. So these kind of things will happen. So the neuroscientific studies of the memory are important, both to understand how they have contributed to general theories, whatever theories like we have developed, and investigate how specific neural circuit and system enable the learning, and how specific neural circuits brain का जो पार्ट है वो, and the retention of the specific form of knowledge, and how we specific form of जो knowledge है, how we store it, suppose. So that is what we are going to study. So human brain damage and amnesia. Now we have to before going to this topic, now I will explain here, right, how we study human being, because there are some ethical issues. When you are studying on human, so you cannot do that. You will take a human being just like many people like take animals and they dissect it, or they will open the brain of that, like rat or pigeon, whatever they are taking. Or so even there are a lot of ethical issues also related to it. So you cannot do that with human brain, because human, you cannot without any reason you cannot open the brain of any person, or you can study it, you cannot do it. So so how we study it? The people who met some accident or some trauma, or there is some lesion, or जिसको हम बोलते हैं the tumors and all in the brain, and when they come to the neurologist or neuropsychologist and neurosurgeons or psychologists for cognitive retraining and all, then what we do is we study those cases, because they already have like some illness or disease related to the brain, and that is affecting his or her behavior. So this is how we study. So that is why human memory, brain damage and amnesia. So many studies have been done on amnesia. Amnesia is like when there is a loss of memory. So that is what amnesia we say. Like you may have seen the movie Gajni, where that actor or main lead role who is played by like Amir Khan, was affected by short-term memory loss. Similarly, there are other memories like other movies are there. So I'm not going into that. So now in this like we can say deficit in memory as a function of brain damage. So deficit in memory is a function of 1 minute. Deficit in memory as a function of brain damage, disease or psychological trauma known as amnesia. So any kind of deficit in memory is called as amnesia. Amnesia can involve either the inability to learn new things or loss of previous knowledge or both. So, inability to learn new things. You are not able to learn new things. If you will see the movie Gajni, that Amir Khan was not able to learn new things. He used to forget means by whatever once he learn and then he forget it. So he is not able to store the information. That is inability to learn new things or loss of previous knowledge. Whatever you know, you forget about it. So that is movies में देखते हैं बहुत बार ना कि and that is like in if you say in old movies like after trauma they say where I am, who I am, that kind of thing. That is loss of previous knowledge, or maybe both is also present. It can differentiately affect short-term working memory and long-term memory abilities. So short-term memory, long-term we have already discussed, and then so this kind of things, amnesia may affect both the long-term and long-term, short-term and long-term. Thus, by examining amnesia in conjunction with the cognitive theories derived from experiments on normal subjects, we can understand the organization of memory and neural level. So, like you can say he if we will do some experiments with normal people not like doing any kind of surgery or something. Normal people mean like people like us, and if we study them, how they store, how they recognize, how they retrieve, how they encode, so we can find out the way out how memory is organized. And when we study the people who have some kind of problem in brain, then we can understand how that problem affect the person's like memory and learning. So in that way we can learn about memory. Amnesia means loss of memory, so about memory and learning, right? So that was it. And then now we are coming to surgery एंड मेमोरी लॉस. जो एक तो अब क्या हो गया मेन जो था वी कैन स्टडी normal human beings, how they organize information, how they learn, all those things. And then we can also study, as I said, the people who have some kind of brain surgery or trauma and how it affects the memory. So you can say in late 1940s and 50s, surgeon attempted to treat neurological psychiatric disease using variety of neuropsychological procedure. So let me tell you, like there was a like term we call it temporal lobotomy. Yani lobe मतलब brain is divided into lobes, right? There is a picture I think in next. These are the lobes, like this is frontal lobe, then this is like temporal lobe, this is occipital lobe, है ना? And then this is parietal lobe, this is occipital lobe, and this side, both the side, like we have temporal lobe. So divided, it is divided in lobes. So we call it temporal. Like when we remove temporal lobe, part of temporal lobe, we call it temporal lobectomy. So so in 1940s and 50s, like neurosurgeons started working on brain because they get to know some areas which can affect the person's ability to memorize or different other functions. So to treat these psychiatric problems and neurological problems like seizures and all, they started performing surgery. So including prefrontal lobotomy, removing the disconnecting the prefrontal lobe. यानी they disconnect the prefrontal lobe, part of a lobe. And corpus callosum. What is corpus callosum? Corpus callosum is this thing. This one is corpus callosum. This which connects this part, which connects right and left hemisphere. Hemispheres are like our brain is divided into two parts. If you divide, if you draw a line in the middle of your head, so one part is like one and this is symmetrically they are similar, and one part is right hemisphere, other one is left hemisphere we call it, and each one has like half of like temporal lobe, half of parietal lobe, and everything, so it is symmetrical actually. So corpus callosum octomy means corpus callosum, removing the corpus callosum, surgically sectioning the corpus callosum. Amygdala is a word. Amygdalotomies means removing or disconnecting that amygdala, and temporal lobe resection, removal of the temporal lobe. These kind of things like surgeries they started performing, and these surgical procedure opened a new window on human brain function, as they revealed, and uniquely quite by accident fundamentally important principle of organization of human cognition, how human cognition is organized. And one surgical procedure uh, relevant to the memory was removal of medial part of temporal lobe. Understand one thing, like temporal lobe is supposed to play a vital role in memory, all kind of memory. So temporal lobe is related to memory. Understand, remember that thing. So one surgical procedure relevant to the memory was removal of medial portion of temporal lobe, and including the hippocampal formation. So that affects memory. So temporal lobe is very important in memory. And then let me clean it first, so that when I will draw you can understand. 1 minute. Right. Now, in 1950, a medical conference, the neurosurgeon William Beecher Scoville from the Montreal Neurological Institute reported a bilateral removal of the medial temporal lobe in one epileptic patient and several schizophrenic patients. Shortly thereafter, he wrote. So, what, like in 1953, you can say, in medical conference, neurosurgeon Beecher Scoville of Montreal Neurological Assessment reported bilateral. Bilateral means, when we are saying bilateral, yani both side of the both, from the both hemisphere. Like your brain is like that. Let me who, like people who don't know this, like suppose one part is this, है ना, and one part is this. So in center, my drawing is not good, but it is symmetrical. So one may be right, one may be left, one will be left. So bilateral means if something is there, so that is a symmetrical part is there. So you can say if we are removing this much part, so we are also removing this much part. So this is bilateral resection. So both side. So bilateral, and on different patients, like he has done the surgery, and epilepsy, you know, I think epilepsy is like seizures, like जिसको हिंदी में हम मिर्गी के दौरे भी बोलते हैं. So sometime it is required to perform surgery. Reason being because there is no medication that is like helping the client, so we go for the medications also, surgery also. So he has done a lot of like surgery on epileptic patients and the schizophrenic patient. Bilateral resection of the uncus, this is a part, and amygdala alone or in conjunction with entire piriform amygdaloid hippocampal complex has resulted in no marked psychogenic psychological behavior changes, with the one exception of very grave recent memory loss, so severe to prevent the patient from remembering the location of the room while he lives, the name of the close associates, or even the way to toilet. So he said, like he found that a removal or resection of uncus amygdalum alone, or in conjunction, or including entire piriform amygdaloid hippocampal complex, जिसमें amygdala and hippocampal both are included, has resulted in no marked psychologic और बिहेवियरल चेंजेस. सो कोई भी बिहेवियर और साइकोलॉजिकल चेंजेस नहीं दिखे. सिर्फ एक केस में ही हैज़ फाउंड that there is severe memory loss, where the person is not able to remember his own people or his own room, where is toilet, where is like his room and all, he was not able to recall it, right? So uh, this was, you can say, he has done, he has find out that thing. So Scoville and psychological psychologist Brenda Milner did the neuropsychological examination of the patients. Understand what is neuropsychological examination. So like if you know, like CT scan and MRI, जिसको हम like we say magnetic resonance imaging. So in that, what we do, we study structure of the brain. You can see that those things, but you cannot see where is memory, where is attention, where is concentration, everything. So psychological tests are very precise. When you do, suppose if you have done some brain scanning on some client to see if there is any change in the brain, so maybe there is no change, because in structural part it is like when it is very prominent, then only you can see changes in the brain structure. uh, but in functional way, how it is affecting your like day to day functioning can be like detected much before there is visible changes in the brain. So if there is no change and you are seeing some changes in the psychological test, psychologists are like we will give some task related to memory to the patient, and we see how they perform, and then we will compare that thing to the other normal people. If that is at par with normal people, then it's okay. If that it is going down, it means there is some problem in memory. So that is what psychological test. So they assess the functions, not the like brain structure and all. So they have done psychological neuropsychological, you see, and we call it neuropsychological examination. So Miller found that memory impairment in the patient having medical temporal lobe resection as a part of their treatment were in relation to how much the medial temporal lobe was removed. So जो functions था वो इस बात पे depend था, it was dependent on how much part of the medial part of the temporal lobe was removed. So the further posterior along with the medial temporal lobe, the resection was the worse the amnesia. So if the posterior मतलब पीछे का हिस्सा हम बोलते हैं, and medial means का, anterior means आगे. So when like there is a posterior medial temporal lobe, the resection was worse with worse the amnesia. So amnesia means जो memory loss है, that increases if posterior along with medial we have removed. Strikingly, however, only bilateral resection of the hippocampus results in severe and if we remove bilateral, now you know, resection of the hippocampus resulted in severe amnesia. If we remove like hippocampus will be given, this is the hippocampus, you can say this part, this one. If it is bilaterally, means both side we have removed it, then this is severe loss of memory. So so that was like, so now you can remember, like if we will summarize, so summarize, so main part is like amygdala, hippocampus, temporal lobe. These are the main parts, or you can say related to memory. Remember that, because maybe you may get any question or something in your examination. All right. Now this is an example that we'll talk about. This is interesting one, and it is kind of a story, so you will remember better. So the case history of HM is one client where the study has been done, and he was a young man who suffered from difficult to treat form of epilepsy that's progressed in severity during his 10 years. So he had epilepsy that was resistant to treatment. The treatment was, medicines were not effective on him. Over the years of the physicians has treated him with the available drugs to minimize his seizures, but these drugs were largely ineffective. So कोई भी drugs that was not working on him, so doctors have decided to do like surgery. So what they have removed the medial temporal lobe bilaterally and from both the hemispheres. And this procedure was called, as I said, told you, temporal lobectomy, yani removing the temporal lobe, right? So, and what happened? So during after the this surgery, his epilepsy did improve. मतलब epilepsy जो है that improved, but was experiencing new difficulties. Epilepsy तो ठीक हो गया, it was better, but the problem is there is now other problems are there, है ना? So what problems were there? HM displays clear problem with his memory, right? And when he was 29-year-old, he reported his age to be 27. Madam, he 2 years he was not able to remember. HM would say he did not remember ever meet certain individual even when actually spoke to them. Like whenever person is he is meeting someone, he used to forget about it and he don't remember that he ever met that person. And immediately it happens. So that means he was not able to store and process the memory to long term memory. So short term and long term both were affected. However, HMN did not have the kind of amnesia once is depicted in television. So forget about it, because television and everything they shows differently everything. So indeed, HM knew who he was, could remember the things about his life that is up until period prior to his surgery. So before surgery, whatever has happened, whatever memories were, that he was able to remember, but he was not able to form new memories after the surgery. So because we create memories every day when you are meeting someone, so that is stored in your brain, but he was not able to store that thing in the brain and process. So he was not able to learn new things. That was the problem. So, and when you are not able to store the information in short term memory and then you cannot transfer it to a long term memory, so both the memories were affected. So formal neuropsychological test, let me clean it. So formal neuropsychological tests were performed on HM and established the nature of his cognitive deficit. Now I think you are clear with what is neuropsychological assessment. है ना? And these tests showed that his intelligence was well above normal after the surgery. So his you can say IQ was normal, above average, but as it was before the surgery, right? And he also had no perceptual language problem, seemed generally fine with changes, no changes in personality and motivation. So there is no other perceptual changes, personality changes, perceptual change, how you perceive things and everything, there is no change in that. And there is no change in personality, because when brain is affected, sometimes his personality changes also. Patient become like more aggressive, more submissive, or some other changes. So behavioral changes भी होते हैं, we call it personality changes. And the motivation and also there was no change in that. So however, when memory tests were administered, HM scored below average normal. As we seen, he there was a problem in memory only. The bilateral removal of HM's medial temporal lobe produced a highly selective deficit in memory ability, leaving other cognitive function impact. So means other cognitive function like motivation, personality, concentration, everything was fine. The only selective thing that is affected was his memory. So normal short-term memory, but the developed with severe permanent inability to acquire store new information. He has difficulty in acquiring new memories and transfer of the information for short-term to long-term memories. Because if you have to remember, you have to transfer the transfer the information from short-term to long-term. When then only you can remember the things. So these were the you can say that was the study on HM. So that you can quote in your examination when you are writing your answers. So this is the brain structure, this is like frontal lobe, this one is frontal lobe, you can say, जो ये divided है यहाँ से, like you can see this one, these are the gyres, we say it gyres. This one clearly divisible. This is frontal lobe, and this is your temporal lobe, and this is your क्या कहते हैं cerebrum, and we call it, this is one temporal lobe, right? So this is frontal, and sorry, 1 minute, this one, frontal is this much only, this one is frontal, this is parietal, this is temporal, this one, and then this one is temporal lobe, and this is cerebrum, right? This connects to like your spinal cord. And what they do is, understand, this is, we call it sensory motor area. Sensory motor, you know, sense or senses का जो information आता है, as well as the motor information. And the frontal lobe, this is basically that differentiate us from animals. This is the part that is involved in logic, thinking, taking decision and all. And this part of this lobe we call prefrontal area, and this is called Broca's area in left hemisphere. And the Broca's area is basically related to your speech, whatever I am talking, and when I am using my motor movement, means like movement in tongue and lips to produce certain kind of sound, that is regulated by Broca's area. And then temporal lobes, it is related to memory, and this part is related to, you can say, auditory memory. And parietal lobe is this, and the visual, occipital is involved in visual, like how you see and perceive things. And visual association is where all the information for visual data that you get is processed. Auditory association, this part, association means when this is getting associated some information that is stored in our brain, and we are making sense of that sound. So that is what we call, you can say, that is the association areas, or we can say 1 minute, I think this one. So that is association areas where all the information is processed, you can say, right? So now we are coming to new subtopic, that is amnesia and medial temporal lobe. Till now we are studying that also, like medial temporal lobe is related to this amnesia. So which region or regions of the medial temporal lobe were critical for supporting long-term memory loss in HM? The medial temporal area includes, and now we have to understand what medial temporal lobe is a broader term, and what are parts or subparts that medial temporal lobe includes. So amygdala, you can say amygdala, hippocampus, remember these things, entorhinal cortex, and the surrounding parahippocampal and pericortical areas, figure 1.3.1. If this one is the 3.1, this one. So amygdala, hippocampus, this area, and this area you can say, you can call temporal, medial temporal lobe, right? So that includes this. So you remember these things. Then reports by Scoville, who performed the surgery, indicated that all HM's hippocampus in each hemisphere had been removed, and HM's brain and surgical lesions were re-evaluated with improved accuracy with high resolution neuroimaging methods like MRI, right, reasoning. And it was found that in addition to hippocampus, some of HM's surrounding cortex was also moved. Suppose this is hippocampus, so other part of the hippocampus were also removed during surgery, मतलब हो गए या जब हम सर्जरी कर रहे थे. So is the damage of hippocampus sufficient to block the information of तो question arise हुआ क्या था, only if it is like hippocampus is affected, and then memory, long-term memory will be like in problem. So he has like talked about other friend called other patient, that is RB, who lost his memory after the ischemic episode. Ischemic episode means when there is a low blood supply in your brain, and your some of the your brain cells dead, become dead. So that is what ischemic episode bolte hain. This is brain stroke, you can say, during bypass surgery, because you are doing bypass surgery, and then there is a like stop, the blood supply stops in the brain, then it happened. And RBD developed sense dense interrogate amnesia similar to HM. And and now you have to understand what is interrogate and retrograde. There are two kind of amnesias. So uh, developed dense interrogate amnesia similar to HM. So what HM had a problem, HM's problem was he was not able to learn new information. So that is interrogate amnesia. He is not learning any new thing. And there is retrograde loss. Retrograde loss means whatever already you, retro means purana, you know that, like retro movies and retro songs kind of thing. So retrograde means whatever you have learned earlier that is affected. So he also had a retrograde amnesia that extended back to 1 to 2 years, like पिछले 2 साल का 1 or 2 साल 2 years he was like there was a loss of memory. After his death, RB's brain was donated for study and permitting the detailed analysis of the extent his neuroanatomical damage कि कितना उसको brain को damage हुआ था. And in RB's case, lesions were found to be restricted to hippocampus, and like in HM's case, hippocampus and other surrounding areas were affected, but in RB's case, only hippocampus were affected. Within each hippocampus means like for both the sides, RB had sustained a specific lesion restricted to CAI pyramidal cells. So CA1 pyramidal cells, this is one kind of cell. So that is what he has found, and like in hippocampus. HM had only interrogate amnesia, and these RB had both the retrograde and interrogate amnesia. Now you know what is a retrograde or interrogate. And these findings in patients RV support the idea that hippocampus is crucial in forming long-term memories. Now you know how we study. So in RV's experiment, it was found that hippocampus is crucial in forming new long-term memories, right? So that is what we have learned from these studies. So right, so that you have to remember. So which part is important in that is in long-term memory, any LTM, that is hippocampus. So understand this. Sometime in 1 number question you can get it anywhere, like if you are like going for any examination, right? So now now we are coming to another topic, that is memory consolidation and hippocampus. So memory consolidation and hippocampus, what is it? Consolidation means how you consolidate, how you strengthen your memory, and what is the role of hippocampus in that, है ना? So like memories are solidified in long-term stores over days and weeks. So it goes into long-term memory in weeks and hours. Suppose you are learning some new material. When you learn, what you do, you revise it, you understand that meaning, and gradually it goes into your long-term memory. So it takes time, right, to consolidate, and because there are related biological changes in your brain. So that is what we call consolidation. So up what happens is कि when there is a damage in medial temporal lobe, that is like and then what happens is this consolidation doesn't happen, information doesn't go from short term to long term memory, and that creates a problem. Then you are not able to learn new things. So because, and then you have to understand, like I'm reading from the book, like because damage to the medial temporal lobe does not wipe out most of the declarative memories, and from over a lifetime we know that hippocampus is not the repository stored knowledge. Means when it is you can say when hippocampal is damaged, so retrograde amnesia doesn't happen, like you remember the things of your life that has happened in in previous years, like in your childhood and young age, whenever like maybe before that problem. So it is established that it is not involved in repository, yani in not involved in storing the knowledge. It is just creating new memories, kind of thing, but it is not involved uh, in it is not affecting the stored knowledge. The new knowledge that is happening, the person is not able to learn, but old one is there is no problem in that. So rather the medial temporal lobes appears to support the process of formatting new memories. Only new memories को follow करा जो that is what I told you, है ना. And that is the hippocampal region is critical for the consolidation of information in long term memory. So medial temporal lobe तो नहीं है, but we are saying that in consolidation hippocampal region is important, that we have the strongest evidence that hippocampus is involved in consolidation, that amnesic have retrograde amnesia from memories from 1 to few years prior to damage of the temporal lobe and diencephalon, that is a part of the brain, and does not support storage role but role of consolidation. So medial temporal lobe is is not affecting your like old memories, but hippocampal region is critical for consolidation of information. So when you are learning new information for and it is not consolidated in your brain, so you will not be able to remember. So if hippocampal is not there or there is some problem in that, the person is not able to do that. So so it indicates that ki hippocampal area is related to your consolidation, right? So that remember that thing, and because that if you will remember that class, you will be able to write it down. What might consolidation entail at the neural level? One idea is the consolidation strengths association of multiple stimulus input and activate the previously stored information. So how that thing happens, like when how consolidation happens actually. So what happens, because it creates association with different information. There is neural process and that associate one thing to other, you can say. So what happens is uh, because we have already some information, so when we get new information, so we revise it, we connect it with the older information, and then we are able to store it properly. And the hippocampus is hypothesized to coordinate the strengthening, but the effect are believed to take place in neocortex. Neocortex जो नई develop हुआ brain part है. The idea is that once consolidation is complete, the hippocampus is no longer required to storage or retrieval. So means कि hippocampal area is involved in consolidation, but once consolidation has happened or complete, then hippocampus is not and it is not having any role after that, and no longer have any role in that storage and retrieval. Now the information is sent to the long term memory, and there it is stored, so there is no role of now hippocampus to retrieve it or something. So the part of the hippocampus is only important for the consolidation. So understanding, and nonetheless keep in mind that although the memories are stored in the neocortex, so कहाँ है in neocortex, the hippocampus is crucial for consolidation. So though it is stored in neocortex, neocortex मतलब your brain का जो area है, जो बाद में develop हुआ है. बाद में develop means it is not like in this, but you can say over the evolution of human being, how we get differentiated from like animals, because we have higher level of logical and reasoning ability. Okay. So hippocampus is crucial only for consolidation of memory. Understand this thing. Then there is a disease, we call it alcohol Corsakov syndrome, like that I have like highlighted in pink, and diencephalic amnesia. The alcoholic Korsakov is a neurological disorder that happen to chronic alcoholics. And in इसमें क्या होता है, the medial temporal lobe is not only the area of interest in human memory. Amnesia emerges from brain damage in other regions too. So it is not only the medial temporal lobe, but there is other areas which can also affect your memory, right? So for example, damage to the medial structure of the diencephalon, that is a one part of the brain, causes amnesia. The primary structure are the dorsomedial nucleus. So कौन से structure है? Dorsomedial in axil, thalamus and mammillary bodies. So remember two three things like medial temporal lobe, hippocampus, and the role of the hippocampus. And now we are talking about the dorsomedial nucleus, and जिसको डाइनसेफेलॉन का एक हिस्सा है, and thalamus and mammillary bodies. So if you want to understand brain in a better way, so you can refer like any video or book to understand these different organs where part of the brain where they exist. Though image 1.3.2 is given there, as they said, damage of these midline subcortical region can be caused by stroke. So, is brain stroke, any kind of tumors, any kind of metabolic problems, and chronic alcoholism as well by trauma. So in these are the reasons why this like diencephalon areas are damaged. So we have seen in those cases also like there is some memory loss, right? तो रशियन साइकेट्रिस्ट सर जे कॉर्सेकॉफ, जिनके नाम पे अल्कोहलिक कॉर्सेकॉफ सिंड्रोम वी हैव गिवन, रिपोर्टेड एन एंटेरोगेट एंड रेट्रोग्रेड. नाउ यू नो व्हाट इज एंटेरोगेट एंड रेट्रोग्रेड एसोसिएटेड विद अल्कोहलिज्म. along long term alcohol abuse can lead to vitamin deficiency and brain damage, because our brain needs some kind of nutrition. So if there is a deficiency, so that can lead to brain damage. Patients suffering from alcoholic Korsakoff syndrome have degeneration in the diencephalon. So Korsakoff, so there is a degeneration, yani decay in the brain cells, especially the dorsomedial nucleus and thalamus. Understand these terms, that because important terms you have to write in the book. And mammillary bodies, it remains unclear whether the dorsomedial thalamic nucleus is mammillary bodies or both necessary for the patient's amnesia. Nonetheless, damage in the diencephalon can produce amnesia. So the thing is, it is not clear which part and how much part is involved, but it is clear that diencephalon can produce amnesia. Damage in diencephalon can produce amnesia. So that was it for today's class, and in next class we will start with point these subheading 3.4, and most probably we will finish the this unit in next one class. Thank you very much for watching.